Welcome everyone. Good evening, good afternoon, good morning for some, because we know it's some if you live in the Middle East or in Africa. Thank you for coming. Welcome. Please tell us what country you're from by posting in the chat. I am not seeing the chat, but please let us know where you're from by posting in the chat. Oh, yes, we have people from Egypt, all the way from Egypt, US, Barbados, Nassau, Bahamas, Jamaica. Oh, it's midnight in Egypt. Thank you. Trinidad and Tobago, Grenada, Trinidad and Tobago, Suriname, Belize. Oh, Puerto Rico, the US, Trinidad and Tobago again, Puerto Rico. Welcome, everyone. Thanks for coming. The USA, welcome everyone. Jamaica, Tobago, St. Lucia, welcome. Good to see everyone again. The Dominican Republic, St. Kitts, Nevis, all the way from the Philippines, welcome. Trinidad and Tobago, welcome. We have people from all over the world, all over the globe coming to join us. Oh, we really feel honored. Thank you. And those of you who are now joining, continue to let us know where you're from. We really appreciate that. Well, I think we could go ahead. I am Dr. Paula Henry. I am from Earth Medic, Earth Nurse. And today we are going to have another exciting, I would say interesting series where we are going to learn from our experts. We are going to be doing a practical climate action for the Caribbean health professionals, a how-to series. Climate communication with your patients is what we'll be focusing on today. But we know this is not only for Caribbean health professionals, because we have professionals from all over the world. Today, I would also like to acknowledge our partners, Colombia, from the Global Consortium for Climate and Health Education, and for University of the West Indies, and of course, my own organization, Earth Medic, Earth Nurse Foundation for Planetary Health. Welcome everyone again, and it's good that we're all here to join, learn from each other, to have takeaway messages that we could all take back to our communities, share with our patients, so that we will become the change agents for now and for the future. Okay, what's our goal for today? Our goal for today, as part of this monthly webinar series, it will focus on equipping you health professionals with hands-on techniques, leadership strategies, and teaching tools for promoting climate action in different settings. And what are our objectives? Our objectives today would be to understand the role of health professionals in raising awareness about health impacts of climate change and providing personalized guidance to protect patients' health. Also, to learn effective strategies for integrating climate-related counseling into various aspects of clinical practice, including healthcare screening, history taking, long-term condition management, and discharge planning. And another objective would be to develop communication techniques tailored to the socio-cultural context of the Caribbean region and to address patients' climate-related health concerns and to enhance the overall well-being of patients. Now, a lot of you like to know if you're getting CMEs. Yes, you can get 1 CME credit for this session. It's only available to CARICOM participants. The application is made by completing the survey link posted in the chat before the end of the session. Look out for that link. This survey link would be live for 24 hours after the close of the session. So, to state again, the survey link will be posted in the Zoom chat before the close of the session. And if you want to get CMEs, you can apply for those within that survey that you would be taking. Now, for the exciting part today, our presenters, Shalini H. Shah, D.O., Enrique Falceto de Barros, MD, Ben Fulgencio-Turner. We welcome them and we cannot wait to hear from you. I am going to introduce our presenters. What we are going to do is to introduce all of them at the beginning, and that would allow us more time to let them tell us all about what they have to tell us today. So we're going to start off with Shalini H. Shah. Shalini H. Shah, D.O., is a board-certified pediatrician and an environmental medicine specialist, providing clinical care for patients with environmental exposure. She is an assistant director for the Boston Children's Pediatric Environmental Health Center and a Region 1 Pediatric Environmental Health Specialty Unit, where she's also co-director for the Environmental Justice and Climate Change Scholars Program. Dr. Shah is passionate about the intersection of the climate crisis, environmental justice, and children's health. Her research and academic efforts are aimed at bringing environmental health to the bedside via the development of an environmental health screening tool that is integrated into clinical care to boost referrals and resource utilization by families. This project was awarded the 2022 Asthma and Allergy Foundation of America New England Medical Research Grant. But that is not all Dr. Shah does. Dr. Shah is developing patient-facing materials and how climate change impacts health and sharing what families can do to prepare and adapt for climate change. She is instrumental in developing a continuing education curriculum and quality improvement projects to help pediatric providers integrate climate counseling into clinical care. Her work has been presented both nationally and internationally. Dr. Shah is the National Climate Advocate for the Massachusetts chapter of the American Academy of Pediatrics, and she serves as the co-chair for the American Pediatric Association Environmental Health, Climate Change, and Sustainability Special Interest Group. It is a pleasure and honor to have you join us today, Dr. Shah. And then Dr. Enrique Falceto Barros. I just call him the president of Planetary Health. Dr. Barros is a rural family doctor in Brazil. He is the professor of the Universidade Feevale. He's a member of the Brazilian Planetary Health Group at the Instituto de Estudos Avançados at the Universidade de Sao Paulo, Brazil. He's a member of the Lancet Commission on Sustainable Healthcare. Enrique has been a family doctor of a rural town, and I dare say in a biodiversity hotspot in the mountains of southern Brazil for the past 12 years. From birth, he has been a compassionate environmental health activist, and his mom teases him that he is a planet doctor. Enrique is the past chair of WONCA's Working Party on the Environment. WONCA is an acronym for the World College of Family Doctors. He also coordinates the policy brief for Brazil for the Lancet Countdown, tracking progress of health and climate change. Welcome, Dr. Enrique Barros. And then we have Ben. Ben Helsin, sorry, please forgive me. Fulgencio, I got this right now, Turner. He is the Director of Climate for Health ecoAmerica, where he leads the Climate for Health program, a national initiative to build climate leadership and action in the health sector, advancing solutions that protect personal and community health. Ben started his career as a community organizer in New Orleans, supporting neighborhood leaders and building power in communities recovering from Hurricane Katrina. He has studied and worked within systems of safety net healthcare for over 14 years, developing cross-section partnership to address the root causes of health inequity. He received a BA from Tulane University and an MPP from Georgetown University. It is great to have you here, Ben. So I am not going to take any more of your time because we are waiting patiently to hear from our presenters. And so we are going to start with Shalini Shah. So Shalini, can you kindly share your screen with us? I will stop share now.
Perfect.
Yes, Shalini, thank you so much.
Let's see here.
Okay. Right, looks good.
Thank you
Really
so much for
good.
having me. It's a pleasure to be here and an honor to be a part of this panel. I have nothing to disclose, but just wanted to acknowledge our funders and partners through my work through the PEHSU program with the CDC, ATSDR, EPA, and our new National Program Office through the Public Health Institute. And so this image or variation is likely familiar to many of you, but I like to start with it to anchor us on how expansive the climate and health connection is. For those who took the Caribbean Climate Health and Responders course, that looked incredibly robust. The connections of how climate is impacting your regions is extremely clear. Whether that's extreme weather hazards from hurricanes, consideration of water, food-related illness, or vector-borne disease in relation to flooding and drought, heat and temperature-related illness, mortality, or how air quality and pollution is impacting our health, are so important kind of as we consider this intersection. And I like this image in particular because you then see that ring of mental health impact really pointing every aspect in how climate is affecting us, augmenting that and presenting its own new waves of challenges for us to deal with. And all to say that rising sea levels, extreme storms, heat waves are putting pressure on our health systems and communities, as well as access to healthcare as a whole. So climate is really proving to be this transformative moment in medicine. And as health professionals, we're not just witness to that change, but we are key players in addressing these challenges. Our role goes beyond treating the illnesses that may arise from climate-related impacts, but also kind of using our power and privilege to advocate for climate action, educate our communities, and shape policies that prioritize both environmental and human health. This is really a moment for us to lead with urgency and compassion, ensuring a healthier future for generations to come. And as a pediatrician, this feels especially urgent, kind of recognizing the reality that every child born today is affected by climate change. 88% of the existing global burden of disease occurs in children under the age of 5, but we know that these impacts kind of move upstream and affect us throughout our lifespan. And so our responses and engagement on these issues is critical to shaping the health of our patients and those of future generations. And the good thing is that there's growing kind of awareness around climate change and public trust in healthcare professionals to be leaders on these issues. So in 2022, a 10-country Caribbean perception survey of the public on understanding of climate change, respondents were asked what their thoughts were about how much climate change may affect human health, and 76% reported that they believed it to have a moderate to large impact. This image here shows that Ministry of Health officials ranked highest as trusted sources of information on harmful health effects of climate change. And these findings parallel studies in the US, where research has shown that healthcare professionals are among the most trusted sources of information on health-related topics, including climate change. A 2020 Yale survey found that 83% of Americans trust their doctors for information about the global warming health impacts. And further studies, particularly work led by ecoAmerica and the American Climate Perspectives work, which is great to have Ben here today, has really shown health to be like a unifying factor around these topics. There's also general perception that the public wants more engagement to protect people from these health issues. So here from the same survey, when asked, should each of these different groups listed on the left be doing more, the same, or less around these issues of climate and health, the overwhelming majority across all sectors, including the Ministry of Health, is that the public is expecting more from us. And so together we can see that we're trusted, and people do want us to be leading on these issues. And health professionals can leverage this public trust and expectation to become vocal leaders in advocating for systemic change, integrating environmental considerations into caring for patients, and promoting climate-smart healthcare. I found these two graphs particularly interesting from that survey because though it's reassuring that large percentages of the population are recognizing climate as a health threat, these really show that there's still much more work to be done. So on the left, when asked what groups or types of people in the Caribbean do you think are more likely to experience health problems related to climate change, you can see only 55%, so that red portion on the left, recognize that those with pre-existing health conditions are at higher risk. And this kind of amount of endorsement of that is lower as you go across, even though we know these are vulnerable populations. So children, outdoor workers, disabled people, pregnant people, Indigenous people, immigrants, the healthcare sector kind of as a whole. And then looking at the right, when asked what are the main impacts of climate change that you believe most affect human health in your country, extreme weather events, extreme heat, air pollution all kind of rise to the top. But again, these numbers are really ranging from 50 to 60%. And so there's still large portions of the population that will benefit from our engagement, awareness, and education on these issues. And so we're in this kind of like tough but powerful place where we can advocate for upstream change and kind of build this green, healthy, beautiful world where we have resilient patients and communities, but also on the right, kind of balancing the reality that the climate crisis is here and affecting our patients now. And so climate communication and kind of bringing our understanding to our people is really necessary to provide care that's comprehensive, up to date, and will build resiliency in our populations. And so keeping that in mind, I kind of wanted to share a few different frameworks of how I kind of think through like where climate fits and some work kind of in the field. I love this figure and those developed for climate-informed primary care pediatrics. I think this can really be leveraged across different specialties. It frames climate and the intersections in health really as a continuum where all the way from like screening and intake processes to health promotion and care within the visit, kind of being informed and anticipatory of what climate factors may be affecting that, all the way down to talking to families about it through anticipatory guidance and out into community engagement and referral. And I like that because it really views this as a continuum and empowers providers to say, like, what is my patient or my population dealing with right now? What are the regional considerations? What's happening seasonally? And tailor kind of what levers they're going to push to engage. And then this I find another kind of helpful model in terms of trying to figure out how to layer climate into what's already happening. And so this is a way to look at it kind of in the context of a medical visit. So first, looking at your screening workflows for education or primary prevention. If for those who are screening positive for food or energy insecurity, how can climate be a threat amplifier for that? And how can we intervene early to help families be prepared? Then kind of moving towards medical history or medication review or other diagnostic approaches, kind of what's the climate layer there? And this may be something that you may not verbalize explicitly to your patient, but the consideration is certainly needed so that we don't miss kind of critical things that are impacting our patients. So thinking through chronic medical conditions or medications, teaching patients about how heat can affect their conditions or side effects or how to store medication safely are all a few kind of different touch points there that you could integrate. Illness-related visits, so if something does link, particularly for me, this is often like kiddos with asthma or complex medical conditions coming in post-hospitalization. I find kind of after a triggering event like that, a lot of messaging can really hit home or be even more impactful. And so then kind of when they're outside of that high stress point, talking through like what are the environmental factors that kind of contributed to that, and how can we prevent that from happening in the future, whether that's discussing, how to look up your air quality index or when to start inhalers early or things like that. And then well care or anticipatory guidance, pediatricians kind of this is part and parcel of what we do, and that most visits end with this education component. But I do think in general, healthcare providers are really educators and take really complex science topics and medical conditions and explain them to families in a way that resonates. And so how can we leverage educational materials and partner with the community so that maybe we set the stage in clinic, but then it's reinforced when patients leave, the exam room. And so now that we've gotten to the point where we know kind of what to share or how it may fit, I did want to kind of elevate how to center equity when embarking on climate communication and some guiding principles that I've employed in that. I think the first is really just knowing your community and what's available to them, what are their challenges, and what do they need most help with, and making sure that any sort of adaptation or strategies you're discussing with families are accessible to them, whether that be cost or location, will fit within their cultural practices or their workflows of their life. And then kind of working outside of that to build community partnerships and advocating for upstream change to dismantle, injustice that has stemmed from systemic racism and inequity. But this is a lot, and it's certainly not easy. I'm the first to admit, like, I have not been able to integrate climate into 100% of my visits, nor do I think that that's necessarily the answer. But these are some barriers that I think often come up when kind of talking through how to bring climate conversations to our patients. Time, of course, being a major one because we're also overstretched and there's so much to cover. And also this like imposter syndrome, like feeling like you have to know everything to even get started on this conversation or that it will become partisan and we may not have an answer to questions that arise. But I've really found that, anchoring in on health and having that shared goal with families helps dismantle some of that. And I think when I'm honest with families and say, like we don't know exactly what 100% of the impacts may be of these things or which intervention is going to give you the most bang for your buck in terms of your health, during a heat wave. But these are kind of our general recommendations, and we're learning through that together in real time. I think families really appreciate the honesty and medicine keeps us humble, and hopefully we can kind of learn together. I also think kind of, acknowledging, validating the challenges people have and also kind of catch-22 situations. I think there is a reality where sometimes what our ideal medical recommendation may be is either not really possible or is in direct conflict with another recommendation that could also be informed by environment or climate. In pediatrics, often wanting kids to be outside and engaged in outdoor play, And off screens, for example, can be in direct conflict with navigating, when to be inside during wildfires or extreme heat or minimizing exposure risk from the environment. So I think being honest about that and saying there's not a perfect answer, but using your judgment based on your understanding of your patient and their family can be really helpful. And then, of course, kind of limited resources. I think families need so much um, from us and from our systems to really be healthy. And um, I think working with community partners and finding funding to be able to provide some of these things so the financial cost doesn't fall on families or other things can be helpful. And then just some other general communication strategies. I think always kind of meeting families where they're at, similar to motivational interviewing, but kind of reading the room and seeing when's an appropriate time to start to feel the pulse on this issue and how to weave it in. Again, empowering families, avoiding victimization, by providing kind of knowledge with tangible action steps or things they can turn to. And again, just as local as possible, whether that's the resources you're pointing to or the threats you're highlighting. I think it helps messaging kind of hit home. And so to kind of wrap up a little bit here, I wanted to share a couple of things that we've worked on at our institution to help have some of these climate conversations. Here on the right is our Climate RX educational handouts that we've worked on. They're available on our website in English and Spanish, and we've been working with different communities to kind of tailor the community resource piece to really be reflective of their area. But essentially, each one kind of has a short blurb about the climate health connection in the Did You Know section, tangible action steps families can do to protect themselves or prepare for that, and then links out to either national or state or local level resources that fit within these categories. And we would be happy to partner with any of you to see how this could be useful or adapted for use in your program. So don't hesitate to reach out. Here on the left, I was fortunate to work with a group of wonderful pediatricians through the AAP Climate Network on developing educational modules as well as like a quality improvement project around how to improve climate counseling in the pediatric well visit. And if you kind of go the project route with data, you can get American Board of Pediatrics maintenance of certification credit. But I think more pertinent for this audience is that the modules are free and available through the Emory Nursing platform, where you can kind of see like specific talking points for different climate health conversations and more content to make you feel more prepared for some of these conversations. So I encourage you all to look at that. And then in our small world here, we've tried to do some upfront environmental screening, which is definitely kind of a bigger undertaking. But for those who are interested in that, we developed a environmental screener where we ask families upfront prior to their visit through their EMR about a variety of environmental and climate vulnerability exposures. And then when they come for their asthma visit, we can, directly address them and be a little bit more proactive with that. And for providers to kind of decrease that burden or have it work in a workflow, we kind of flagged what was pertinent to them prior to their visit. We had like one hub where all of the different options to respond to every single question asked were available. So we weren't asking to ask, but instead asking to act. We got some funding to be able to provide physical resources for families and made a series of educational content to give to families as well. And it really helped us better understand the need of our population. Nearly a quarter reported issues with like keeping their home at a comfortable temperature for their family, which was an indirect climate vulnerability measure for us. Those in subsidized or public housing were more likely to report environmental concerns. So helping us kind of lean in on a vulnerable population. And we were surprised kind of a lot of our families were concerned about outdoor air quality kind of more so than some of the indoor exposures, which is interesting to us and helps us address this better at a population level. So I'm happy to speak to any of that for any other questions, but I thank you all for your time and your attention, and we'll pass to Dr. Barros.
Shalini. We really appreciate that very much for that very comprehensive dissertation where you told us all about. I especially like the different frameworks that you shared with us, especially using the infographics for patient. It gave us a better opportunity to be able to deliver our messages when we see this and be able to actually tick this off, and it would give for an easy flow. For me, I don't know how you can do it as a pediatrician because, you know, we people who deal with adult populations, we think, well, you know, things are not going to be so bad in the future. But when you think that patients, pediatric patients who are just born, and we think of 2100, 2100, if we continue with life as usual, how bad things are going to be. And they are going to be only in their 70s. So I think from your point of view, you have to be prepared even more. And of course, you should be feeling that pressure to prepare for your population. I was thinking also about us dealing with climate events that are changing so rapidly that we as health professionals, we really need to get on it and help our patients. And that, as you said, we are the providers and we have to help. I mean, just today I was thinking, I drove into my driveway. I've never seen anything like this. There was a bolt of lightning. I just parked my car. There was a bolt of lightning. I felt it was just about 2 inches from my windscreen, and I could actually see sparks of fire coming out of the bolt of lightning. And I thought to myself, wow, this is how people get electrocuted from lightning. And of course, the thunder that followed that was amazing. And wait, being honest, I think that is probably the best advice that you could give us, because, you know, as healthcare professionals, sometimes we don't always know the answer. And it makes us feel that, okay, well, I cannot venture here. But if you are honest and you think, well, okay, I don't know all the answers, and then we have this option and that option, but we can discuss this with our patients to know what is the best thing to do. I like that advice. And probably that is the best advice that you can give us. So thank you very much. I'm sure people are going to have a lot of questions to ask you, but we're going to keep the question and answer session for later on. And there's somebody asked in the chat, well, I want to tell patients all about these climate messages, but how do I tell them with simple language? Well, I think that is why we have Dr. Barros here with us today. He's an expert at telling patients how to link all the climate difficulties and climate change that we have with the actual problems that we are seeing in our office. So without further ado, without holding you back anymore, I am going to ask Dr. Barros to come on screen and share his slides and take it away. We are waiting. Thank you.
So, hi all, enormous pleasure to be here with you today. And first I want to thank Paula Henry, who is a wonderful colleague and a great communicator. Thank you very much for the introduction, very kind introduction. And say that I enjoyed Shah's presentation, and we do have a lot of complementary materials, so it's going to support a lot what I do, and I learned a lot as well. So considering being an expert in communication, I always try to think to be as humble as possible. So I consider myself an expert in communication with my patients, but I'm sure that if I go to the Caribbean region, I wouldn't be able to call myself an expert, because that changes with the context. And I think this is one of the main messages. So we need to do fine targeted communication, information, and relationships with patients. So now I'm going to start sharing my presentation. Let's see. Just a second. And now my presentation. Okay. Can you see my presentation?
Yes, it's very
Yes.
clear. Thank you for all the colors.
Okay. So I always like to start with this beautiful slide showing that the World Health Day of 2022 was on our planet, our health. So this is an extremely important matter, and we do have to know a lot about this. And I want this presentation to be a message of hope, because we really need a lot of hope and good energies. And thanks again, Paula, for your good energies. Now, the facts are really harsh. So I live in southern Brazil, and can you see my pointer, please? Yes. Okay. So
Yes,
this is
it's clear.
basically Chile.
Mhm.
These are the Andes. I live very close to Uruguay in the mountains of southern Brazil. This is Brazil. And so you see that we still have major fires in the Amazon because of climate change and the most severe drought ever. And the fires, the smoke is reaching my patients and myself. So I see every day patients with smoke problems coming from the Amazon, which is uh, it's as distant as, say, Portugal from Germany, or I don't know, very, very far away. And the sky was dark, and the sun was orange. So these are the times we live in. This year we had the major flood, the worst flood in the history of in Brazil, in where I live. And this was last year, a patient of mine leaving the emergency room by boat. It was in the New York Times, if you want to look it up. And this is where I take my students, one of the places where I take my students. So we can't avoid seeing climate change and health together. We need to be very proactive. And today I'm going to talk only about the communication part, right? Because that's what I was asked to do. But I think there's a lot we can do. So why talk about climate change and planetary health to patients? Because we're all interconnected. So a patient comes to complain with a problem in the leg, and if we go look, we're all interconnected. And really, if you start thinking and meditating and talking to colleagues and scientists, you'll see that most problems are related to climate change, to planetary health, either affecting it or being affected by. So the World Organization of Family Doctors, the Day of Family Doctors in 2024 was Healthy Planet, Healthy People. So, okay, but how do you communicate to patients? And we're starting to consider 1 minute for the planet with patients. And again, if you have if you make this connection to patients, as Shah taught us, we can give good punctual information that may be effective. So this is where I took my students, a family clinic, outpatient, and we saw an adolescent, a teenager, and her mom. She had dengue. I'm not going to enter the clinical details. Of course, we gave her the best treatment, evidence-based, avoid NSAIDs. And of course, we made the diagnosis about dengue, and she knows all about dengue. But we took 1 minute to explain to her the connections of dengue with climate change and with planetary health. So after everything, the whole discussion, the whole clinical encounter, we felt we had a good connection, and that we could give this extra 1 minute. So basically, we explained to her that unless we do things, very concrete actions for our planet, it's going to get worse, right? And it's getting worse. So what could she do? So one very practical thing is to reduce red meat, which is, if you avoid excessive red meat, we know it's connected to increasing the risk of death, especially by colon cancer, but also atherosclerosis. And the fires in Brazil, this major fire was connected to burning the Amazon to create spaces for cattle. So if you avoid excessive red meat, you also protect the planet and your climate and your health. So this is a co-benefit, and it can be an incentive to improve your health and avoid not as good diets. The same thing with air pollution. So air pollution is directly bad for your health. So if we stimulate active transport for the mom and the patient, she will pollute less, and she will harvest the benefits of active lifestyles, and that will be good for the planet, of course. So what do? Basically, we identify health issues that are relevant to the patient, and that could open a window so that the patient could understand the relationship with the planet and how the actions that we take harm the planet and how it will harm us. And we identify potential co-benefits, as we did, so that we have good actions on the planet, and we'll have good actions on us. And these are co-benefits, right? So we benefit the planet, and the planet benefits us, and we also get direct benefits. So when thinking 1 minute for the planet, we're really thinking of offering a seed for the patient, offering a seed. Or maybe we could think of looking for a fertile ground, earth, to offer a tiny plant and see perhaps grassroots growing, like also a symbol for movement, and searching for a critical mass, right? We plant little seeds, little ideas, and we build a critical mass. So at some point it will start a chain reaction that could really lead to substantial societal change and the great transition to a cleaner world. And we're not alone. I'm representing WONCA, the same institution that Paula participates in. So here I am. And we have this vision that climate change is the greatest threat to health in the 21st century, but that it can be the greatest opportunity to go global health in the 21st century. If we get our act together, collective action, and if we do what we have to do, the science is clear, right? We just need to get our things going. So the key message really is to find targeted issues and try to tailor the information to the patient and make sense of it together. And there are thousands of things that we can talk to patients about. It will be different to every patient. And I've been so I work with this for the past 14 years. And first it was hard because people wouldn't even believe in climate change. But now it's obvious. Some people think it's not about the human pollution. It's not anthropogenic. And I think health professionals can really make a difference there. So now I have to talk about climate change all the time if people want to understand why they get sick, because a lot of what I see in my office is clearly connected. And to pollution as well. I see cancer, skin cancer in my office many times, and it's related to the ozone hole depletion that is over my region. So I tell them, listen, yeah, your cancer has to do with the pollution that our friends in the US and Europe opened for us, and we laugh and say, so climate change as well, and blah, 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 you know. So we can do a lot. And I always think of planting seeds, and I know that it has had an impact. Patients have done different things in this tiny, tiny town, which if we make, for instance, we have over 500,000 doctors around the world, family doctors, sorry. And if we all plant seeds, now imagine all the doctors, all the healthcare professionals. This is a real change, right? We've done it many times. We do it with cigarettes in Brazil. It's a huge success. Tuberculosis, variole. We have even nuclear weapons, right? So I'm an optimistic by nature, right? So thank you very much. And this is it. So I'm gonna stop sharing.
Wow.
Thank you very much.
Thank you, Enrique. That was brilliant, as usual. I want to tell you guys a little bit about Enrique. So he actually is, I would call him the president of Planetary Health, and he makes sure that all of us, all the doctors underneath his care, have seeds to plant. So for instance, let me give you an example. So I just came from Phoenix, Arizona, and their temperatures probably went up to 110, 112. And although the humidity was very low, there was a red alert. And I was thinking, I wonder what it is in Trinidad in terms of the heat index. So I did some research and found out that we were also in the red zone. But you know what? There was no alert. Absolutely no alert. So I sent a message on our WhatsApp chat, women's group, and I said, I wonder what's the heat index in Trinidad and Tobago. Not being an alarmist, just trying to find out. And that sparked, I'll see it again, and that sparked a whole conversation among the doctors. And people started to say, oh, my patients were so weak. They were so weak today. The elderly patients, they couldn't do anything. They were so weak. And, they were sweating. Oh, you know what? Yes, they were losing all their sodium, and that made them weak. I wonder what we could do about this. So it's beginning to, if we begin to plant the seeds, yes, and with doctors, yes, and physicians, they're going to begin to help us to think, what is the connection between what we are experiencing and climate? And I think this is what is Dr. Barros, he's trying to tell us. Try to make that connection and try as best, because that is our responsibility to be able to tell our patient what is the link between climate change and health and what we can do to make differences in this climate change. And there's nothing like being aware and being educated as the start of being that change that we need to make as we become aware. So I would like to thank you, Dr. Barros. I'm sure that we're going to have a lot more questions where you'd be able to give us some enlightenment. But I want to go on to Ben Fulgencio, right? Turner, thank you for that endorsement, because he is going to tell us a lot about his programs in ecoAmerica and everything else that he's doing. We cannot wait to hear you, Ben. And I will give you an opportunity to share with us all your insights because we are waiting to hear that. Thank you, Ben. And over to you. Please go ahead and share your slides.
Great. Thank you so much, Dr. Henry. And thank you to Dr. Shah and Dr. Barros. I really appreciate seeing those examples of how people are being really thoughtful and creative and persistent at making these connections with people and giving them tools that help to immediately address their health. So I think I'm the non-clinician here on the group. So I come from a public health background. I'll just pull up my slides. And so I direct the Climate for Health program at ecoAmerica. So we have three big programs. All of these are built around moving the social conditions to create the social conditions necessary to deal with climate change. And we recognize that at this point, it's not a technological or technical problem to solve anymore. It is a people problem. It's a political and social problem. And the way that we are engaging is through the most trusted sectors of health, faith, and then local civic associations and community. So really trying to connect with people on those local values. And as Dr. Shaw mentioned, health really stands out as one of those areas where we can really drive people to understand that it's not about concentrations of CO2 in the atmosphere. It's not about the year 2100. It's about your health and your community's health, your children's health right now. That's how we get people to change, and people trust and respect health professionals to take this, to communicate about this, that they're telling the truth, and that we're offering things to address something that really matters to people, their community's health and their family's health. So I think I don't want to rehash this too much. Dr. Shaw mentioned that people are very, very concerned about climate change. One thing I'll point out is that when you ask how concerned are others around you, there's a huge mismatch between how concerned people are versus how concerned the people are, how concerned you think people are around you. And so this mismatch is called pluralistic ignorance. It reflects a misunderstanding of other people's behaviors and attitudes around climate change. And so it's a problem because when you feel that way, when you're very concerned about climate change, but you think you're alone, it makes you less likely to take action. It makes you less likely to talk about climate change. But the good news here is that we can break this cycle, this bubble, by talking about climate change. You'll be pushing on open doors a lot more than you think you will be. And then, like we've said, protecting the lives of children and future generations and protecting personal and public health is consistently the top priorities for people to take climate change. It cuts through all of the political polarization, the economic arguments. If you frame this issue around future children and future generations, and then your immediate personal and public health, it gets people engaged in taking action. And so I'm just going to put this out here as a challenge for folks. In addition to directly engaging your patients around climate change and your colleagues, and there are so many great tools to do that and to facilitate really productive conversations. Really think about how you can use that credibility and gravitas that you have as a health professional to engage across a full spectrum of advocacy. So it's not just pushing for specific legislation or protesting on the streets. That's one type of advocacy, but there's also talking with your family, with your friends and neighbors and family about those kinds of things you can do on the ground that like Dr. Barros said, have those co-benefits that are part of a planetary solution, as well as bringing immediate benefits of cleaner air, healthier diets, more exercise, preparing and building resilience, saving money on greater efficiency, bringing those conversations, again, framed around your values and your expertise as a health professional to friends and neighbors, to your workplace, to community, your house of worship, community centers, anywhere where you can start to push for those actions to build momentum. A health framing and coming in kind of dressed as a health professional, sometimes literally dressed as a health professional, can really help to push things forward. So a lot of the communication around climate change has shifted over the years, where it used to be catastrophic, and built around the charismatic megafauna of polar bears and what's going to happen in 2100. Um, and we found that is no longer effective, for anyone that isn't already converted. You are preaching to the choir. It's very effective if you're already upset and scared and want to take action about climate change. Reminders of how severe and scary it is can be motivating, but for most people that we want to get more engaged, it is just alienates and leaves them stepping back. Um, there's been a shift to talking about opportunities, about green jobs, about how there can be a transition in the economy. This is more effective, but a lot of people don't trust it. It feels too distant. It feels like a political promise. And it feels both distant in kind of in scope as well as in time. Like maybe there will be green jobs in a few years if everyone keeps their promises, but who knows? And so it's more effective with that movable part of the population than Armageddon, but has its limits. And what we found has been most effective for getting people motivated to take action is really centering on personal relevance and immediate benefits. So talk about your family, your health, and things that are happening right now in your community and how taking action brings benefits right now to your community. So, like I said, that personal relevance, when you're talking about climate impacts, we are not talking about what could happen in 50 years, even if we are pretty sure what the science is saying that what could happen in even 10 or 15 or 20 years, even if that science is really clear and stark and compelling to you, it is not as personally relevant as the stories you can tell about how an extreme heat wave affected a family where the child has asthma, or a person who's on oxygen. So talking about those immediate impacts, and this link to people's lives in a way they understand that, someone had to take off from work to deal with this. The kid was in distress. They needed to be hospitalized for a couple of days. And maybe some people got sick, or I think that we all have those stories. And so making sure that we are making these as relevant and local as possible. I think even in places that imagine themselves to be um, somewhat away and safe, a haven from climate change, we've seen that's not true. We've seen that, in the mainland US, hundreds of miles west of the Atlantic and hundreds of miles north and thousands of feet in elevation can still experience the devastating impacts of climate change. So we can talk about those impacts. No matter where you are, you have a local example. And then talk about ways that people can take those kinds of action. These are those seeds that Dr. Barros mentioned. These are the resources in Dr. Shah's Climate RX toolkit. So giving ways that people can start taking action to protect their health in ways that also have those co-benefits of driving climate solutions forward, and then connecting it to that broader empowerment that you're part of this solution. It is not all doom and gloom. It's part of being responsible for those shared values that we all have of wanting our children to be safe, wanting our communities to be secure, and really as a health professional taking our responsibility there to advocate and push for that safety. So we've built out an entire climate and health communications training and toolkit. So we have a 5-step framework. I'd like to say it does not have to be strict etched into stone following this, but we really recommend studying the process and sequence for these steps to make it so that your climate conversations are things that are productive, that they don't get derailed into politics or get derailed into kind of a doom and gloom cycle where people feel it's hopeless or too late or too far away and too big. That really using this process and ending with an ask, ending with something that you want to give people to do, is fits really well into formal presentations if you're doing leading a brown bag lunch discussion or training at your office or speaking to higher ups in your health system about things you'd like them to do. This is a great structure for this. But once you develop the muscle memory, this can be the structure for really simple informal climate conversations that you might have, um, you know, in line at the grocery store, chatting with somebody, or on the bus. That being able just to, when it comes up, that you're able to follow this sequence in a way that makes it those more productive conversations, not the ones where you leave just feeling heavier or angry or not there. So again, we want to really make sure that we're using this role that we have as health professionals to drive things forward and to help people make those connections. So I'll drop the link for the training and all our resources in the chat in a second. But one thing I have seen, I think it's come up a couple of times in the chat, some of the common challenges that we've heard. So we've trained several thousand health professionals, faith leaders, and civic leaders to lead these local conversations on climate and ask them what are the kinds of challenges you get. So we got a lot of responses for the pushback they get from their communities, the follow-up questions they have a hard time answering. And I've kind of bucketed them into four different categories. So the first being what about? So what about China? What about ExxonMobil? Why are you talking to me about this? I'm too little. It's not about me. Then there's it's too late. We've already passed by this threshold. Nothing's changing. Just look at the news. It's way too late. The competing priorities issue of I have other things to worry about. I can't add this to my plate. And then finally, the full denial that all of this is a hoax or is just politics. I mean, I'll share. I get that a lot less than any of the rest of these. That's pretty rare these days. And so really thinking about how to answer these, getting that what about China? What about ExxonMobil? What about any other larger actor that is, legitimately more responsible for this crisis than you? When you want someone to take action, talk about the local and immediate benefits of taking action, especially if they are deflecting to the moral responsibility is on someone else. Focus on how taking action right now brings them immediate local benefits. So having fewer combustion engines on the streets improves the air quality immediately. And so having the fleet of ambulances and cars in the hospital be switched out brings those immediate benefits. We talked about meat consumption, that there are these immediate benefits. It's not a conceptual thing of doing the right thing purely conceptually. There's an immediate benefit to your health and well-being by taking these actions. That it's too late. I think that we just need to stay focused that even if we pass thresholds, it is better to miss the threshold by a little bit than miss it by a lot. We can't stop. If we can take action now that makes a difference and saves lives in the future, in addition to those immediate benefits. We just can't, even if we are missing thresholds, we can't stop taking action. I have other things to worry about. Dr. Shah and Dr. Barros talked about this. This comes up a lot, especially working with patients that do have a lot of conflicting challenges. And really, it requires a relationship with your patient population and that community, but being able to connect their priorities to the solutions. And sometimes it is planting seeds and being an open space to talk with them. And then finally, that it's just politics. When this does still come up, the full denial, even the word climate change or global warming just immediately provokes a politically polarized response. Then reframing this around air and water, clean air, clean water, more resources and resiliency in community, preparedness for disasters, and saving money, that can help to get through it. You don't want to sink too much time on this if someone is, in arguing in bad faith, but trying to reframe about clean air and clean water can be a way to get people to step out of the polarized view of the issue and reframe around health and their local environment. So I put here a QR code, and the link is here as well, climateforhealth.org/ambassador. So we have a full training program. It's free. It offers 3 units of continuing education. For you all here, the first hour and a half will be pretty familiar to you. You've taken the other Columbia University courses. This does not go in as detail on the different climate impacts, but really focuses on that communications training. So how do you communicate effectively around climate change? How do you use that framework to drive really meaningful conversations? So we have a lot of other resources here. I wanted to get through these quickly so we had the time to chat more. And I'll put a few more resources in the chat. I know there are a lot of tools out there for health professionals to communicate with their, both not just their patients, but their broader communities about climate change and health. So I will stop sharing now so we have time for the Q&A.
Thank you, Ben. That was very informative. And thank you for bringing it home and helping us to remember that communicating the message is very important. Make it personal, make it relevant, tell people, okay, it's not all doom. We have opportunities to do better, and most importantly, empower them to be different. So we are doing some work in one of the communities in Trinidad and Tobago that is impacted by flooding. And I must tell you that right now we have a dengue epidemic where we are having not just people getting the disease, but we're also getting a significant amount of deaths. So we have visited one of the rural communities where there is this flooding, and the people are complaining, you know, we have all this flooding, and then we have dengue, and then we have drought, and we don't get water. So we began to discuss, well, what can you do? Bring it home. What can you do? Well, there's a problem with flooding because you put plastics and bottles into the waterways, so you have flooding. And then when you get flooding, then you get infectious diseases and we get leptospirosis, and there's a problem. So why don't you think about what we can do? Because we can do something differently and we are empowering the community. Oh, yes, we can do this. And then they say, but you know, we have so much flooding today and tomorrow we have drought. I mean, what to do? We have drought. And we say, oh, you have drought, no water? Well, you know, a lot of water falls from the sky. So what about catching some of that water? You know, do you have guttering in your house? Yeah, well, catch some of that water. Well, we know it as rainwater harvesting, right? Catch some of that water. You have big spouts and begin to catch it into your tanks. You have tanks? Yeah, but the tank's far away, they're down the road. Okay, well, get some strong men to bring it up. And then we will tell you how to treat the water to keep it safe. And the people in the community feel empowered. They feel they can do it. They feel they can do something differently. So definitely we understand, make it real, bring it home, empower them, inspire them, and tell them, yes, there are solutions to simple problems of climate that we are encountered daily. So thanks for helping to drive home that message. Well, I see all of my panel here, waiting patiently to answer what questions have been posed to us. Let's see, do we have any questions in the Q&A at this time? Not quite sure. Maybe I could get help here with Daniele.
Yes, Paula, there are 3 questions.
Okay, well, I'm not seeing them. You want to start off with the first question
Maybe you
then?
can go to the Q&A.
Oh, yes, I'm seeing them. I'm
Okay,
seeing
thank you.
them right now. Okay, I'll start off with a question from Jade Murray. Any examples or best practices of the traditional/indigenous methods to treat with climate-related health issues? You want me to repeat that? Any examples or best practices of traditional or indigenous methods to treat with climate-related health issues? Who wants to take a punch at that?
I'm not sure I understood the question. Did you say good forms of traditional knowledges and indigenous knowledges, or did you say bad?
Okay, no, what the person is asking is, they want you to give examples of what can be done to treat with climate-related health issues. What can we do? What best practices can we put into place? to deal with some of these health challenges that we are seeing from climate. They're asking for a few suggestions. I guess
Usually,
whatever you can do in terms
I
of
can,
adaptation.
yeah, usually when I discuss these, I tend to discuss about doing mitigation actions and doing adaptation and resilience actions, like you were mentioning, Paula, in your community that you're working with, and collecting water and stuff like that is really about adaptation and resilience. So if we think about resilience and adaptation of healthcare providers or capacity to deal with shocks from climate change, for instance, there's a lot we can do, like plan on electricity, on safer, more stable electricity or water, and think of places where people can go for heat extreme waves, stuff like that for adaptation. And then when we think about mitigation, of course, we can talk to our patients about it, and probably that's how we're going to have the most effective impacts in mitigation, because then it will have a chain reaction. But directly in our work, the most important thing for, at least for primary care professionals, would be to reduce the prescription of drugs. That's where by far most of our climate impact is. So if you do evidence-based medicine, right, you give the best treatment and reduce over treatment and over diagnosis, deprescribing. So by far, this is really by far the most important action. So truly help our patients. Then you will help the climate.
Okay, so we can see that Dr. Barros is a primary care physician who deals with prevention, because what he has just told you is instead of giving a medication or a tablet for every symptom that you're having, let us look at the causes and eliminate what could be causing this problem. And in so doing, we are really not only treating the problem, we are preventing the problem from occurring and giving the patients less medication, and as we know, decreasing the carbon footprint by prescribing less medication. So thank you very much for that, Dr. Barros. Okay, we have another question from Roshini. And Roshini wants to know, how can one easily start, well, she used the word easily, how can you easily start a conversation about climate change with your patients? I understand what she's talking about, because patient comes with all sorts of difficult things, heart disease, but how do you start a conversation relating this heart disease to climate? How do you initiate that conversation?
I can try to respond to that to start. I mean, I think kind of starting small and seeing where it fits naturally and tailoring it, per person can be really helpful, though that often feels daunting when you're first getting started, right? And so I think when I first started trying to integrate this kind of in residency or in my own clinics, I kind of picked like one thing, and it happened to be around allergy season. And so when I was talking with patients and families, I'd be like, they would be coming in saying, my kiddo's allergies are out of control. What are our medication options? How can we deal with this? And kind of enfolding in, education around how to avoid peak pollen times and what medications to have available or ways to, rinse their pets off before they come inside or closing windows. I also said, we are also seeing this get worse over time as we deal with a changing climate. And how have you noticed the environment, is affecting you all, or have you thought about climate change kind of in that way? And leaving it a little bit open-ended, I think, can bring the conversation in a way that that is meaningful for both of you, because it's interesting to see kind of what families will say. A lot of times I've had families be like, oh my gosh, you're right. Like I didn't think about that, but I'm doing everything I can for my child's asthma and we're not getting anywhere. And there is this external stressor. And I think sometimes that can be validating to say, like, we are dealing with this other big issue, kind of this elephant in the room, and how do we kind of navigate that together? So I think I would say start small, pick one area that you feel, confident in and go from there. And then you'll start to see, climate everywhere and it'll grow from that.
And
Okay, that is very helpful.
I might
Start where you know. Mhm.
I might add to that a little bit, yeah, that I talked with a pediatrician in Montana who, for every encounter, talking with the parents as well, would say, this might not have been something you had to deal with when you were growing up, but now we have to be a lot more aware of wildfire smoke and extreme heat in this region. And so, really framing it around their experience and bringing people in, and then making the connection to climate change, and then offering some of those seeds to get started taking action. So really having that, using that, you might not have experienced this, but as a way to kind of bridge people who might not be excited about talking about this or anticipating some pushback. And I'll just share, because this story really resonated with me, is that she often heard from especially the dads of her patients that don't talk to my kid about this. You're just going to stress them out. You're going to make them anxious about this. They're already worried. You're going to make them more anxious. And it took her a while to figure out how to respond to this. And it really ended up being as simple as, oh, your kid is worried about this. Your kid is anxious about this issue. Have you talked to them about this? Have you listened to their concerns? Are you taking it seriously? Think about when you were an adolescent and upset about something. How did it make you feel if your parent or another authority figure waved it away and said, we're not going to talk about that. It's not real, or it's not an issue. So really engaging with the parent and kind of helping them to step back from whatever their pushback was a really effective way to, again, make this conversation something that could be, even bigger in terms of impact.
Okay, thank you for that. Okay, the next question is from Jackie Lordon, and it's specifically for you, Ben. She wanted to know if the survey you mentioned collected geographical data from respondents, because she's curious as a public health student about the responses that we see from different geographical areas that will be experiencing different disasters because of climate change. So that in one case, it might be heat, in another case, it might be hurricanes. So she wanted to know whether you did collect geographical data from your respondents.
Yes, and one of the really interesting things about this is that when you survey people, even longitudinally, before and after a major climate-related impact, people who say it's not a concern or in the full denial area, having experienced a severe impact does not change their mind. If they are locked in on this is not real, this is not my problem, or even the it's too late, experiencing the impact changes nothing. It really requires social engagement from their peers and from trusted members in their community. That is what changes people's opinion about this, even more than the facts. Which can be frustrating for people who spent a lot of their lives studying facts and in school, but that what really changes people's opinions about things are talking with people they trust and respect and love, and doing it over and over and over and over again. That repetition from a trusted source beats out even the most traumatic and dramatic facts presented to them.
So thank you for that.
Ben, sorry, can you send that link, please? That's outstanding information.
I'll try that
Wow.
send it over. Yeah.
Okay, thanks for that, Ben. Okay, I guess this is for anyone who wants to jump in. And the question is from Telma Neri, and she wants to know how to effectively adopt measures that reduce impacts on vulnerable populations. And she mentions that in Brazil, there are different populations, including the indigenous population and different communities that no longer have any more rivers. The rivers have dried up. And how do you effectively adopt measures to help to reduce these impacts? I guess that was probably Enrique, since it's talking about Brazil.
Wow, that's really hard. We have like terrible pictures of rivers drying in the Amazon, and this is a really complicated issue. And I always try to be very careful. And whenever people say that I'm an expert, I say, okay, so I know a lot about my community, but I wouldn't talk about things that I don't know a lot, because it's really complicated. The sister of my wife actually worked with water issues in northern Brazil. It's highly complex, and maybe someone else can talk about this. So my apologies.
Any other takers? And how are we going to tell patients how to adapt with these extremes of climate that we're seeing, like our rivers are drying up, our hurricanes devastating whole countries, nations. I mean, I guess what the person is alluding to is that there is doom. So what are we going to say to our patients? What are we going to tell them?
Sorry, Ben, but so there's the story, there's the narrative of doom, and then there's the scientific evidence of doom. So I know that the data is really, really worrying, especially if you think about the things that we love, and so nostalgia, and how we're going to lose the environment that we love, that it's going to change a lot. But for instance, air pollution kills over 4 million people from ambient air pollution. So I think that if we understand that we can basically save 4 million people from dying of air pollution every year, just by treating our air and protecting from climate change, that's averting doom, right? We're living in doom right now just from air pollution. So we can take really quick action to end the fires in the Amazon. So we don't need this doom. We can actually regenerate the Amazon. So I don't see the necessity or the fatalist doom, right? I see that if we do what we know we have to do, so it's like Ben, it's a people problem, not a technology or science. It's really a people. So it's really a psychology, social psychology thing.
So you see, Dr. Barros is an optimist, and that's one way he gets you to do what he thinks is best, right? That's one way he motivates you, by his optimism. And, so for instance, yes, I like the idea that we also must relate it to personal histories. So in Trinidad and Tobago, we have a custom where we burn refuse, we burn our rubbish. And that was because traditionally, the garbage trucks never passed. They would never pass your home. They wouldn't come at all for weeks, months to take off the garbage. So people got into the habit of burning their refuse. Of course, that's a horrible form of air pollution. So we started by educating our patients and educating communities by telling them, the garbage truck now passes, but why have you kept with that same tradition of burning the rubbish? Because it's causing air pollution. And we actually started in Trinidad and Tobago to do studies to link air pollution with morbidity and mortality from our diseases, and also for cancer. So also, yes, I like that idea that yes, it's a big problem, but we could also bring it home to patients, to our patients, to let them know, yes, these are the ways we could actually change things. Okay, so we have another question from Jade Marie. She says, how do you address the pluralistic ignorance and help patients really to get motivated about climate change and actions? How do you encourage more interdependence and community strengthening in this fight? I guess that goes to Ben.
Yeah. I mean, I'll start with the second part. And it's the kind of thing where it just requires you to go out and get your hands dirty. You need to be engaged in those local community organizations and groups, know who they are, know the people, be able to make warm handoffs to those kinds of community support and social resilience um, uh, structures that need to exist, especially in frontline communities, in order to help support and grow those. So I think that there's a lot for everyone to do on this. If what makes you tick is facility, greening your facility, that's what gets you up and gets you out of bed, is saying we need to make sure that we are the most efficient healthcare facility in the world. Dive into it. You do that. You work with your maintenance people, your facilities team, work the supply chains, get engaged in the national groups. If you want to stay focused on those community resilience and support groups, same thing. You need to get engaged with them, know the voices, know the people, and be a part of that work. In terms of breaking through the pluralistic ignorance, I think that having a positive message that aligns with people on their values is the way through. That I'm concerned about climate change and I'm not telling you we're doomed. I'm telling you here's something we can do. That cuts right through everything. I mean, that's as simple as I can make it. There's a lot more that can go into it, but really positive message that connects on values as a human being to human being, not talking down to them as an expert, but talking to them as someone who cares about your health and this community's health.
Okay, thank you. So we can just have the very last. Oh, no. Enrique, you must say something. Let's hear. You want to say something?
No, sorry. I was just saying that I loved what Ben said. Sorry.
Okay, thank you. Okay, this is the very last question, and this is coming from Alicia Edwards. So, we're all concerned now about using our air conditions. And how should I advise patients to keep cool when we are experiencing heat waves, and using our air conditions would actually be adding to the carbon footprints? So how are we going to advise our patients to keep cool? That's a hard one.
Yeah, that is a hard one. I struggle with this a lot. I think, this is kind of one of those catch-22 situations, right? Where one of the solutions to protecting your health may be contributing to the issue. I think as a provider and kind of having that environmental justice framework, it's not necessarily my patient's responsibility. It's to independently, solve the climate crisis. And ultimately our solutions do come from top down and coming off of fossil fuels. And so in prioritizing health and safety, I talk through alternative ways to access cooling in terms of like community cooling areas, splash pads, water sources, at what temperatures fans are safe versus more problematic. But I do think that access to air conditioning is something that, I'm really working to advocate for as a health right, for access to patients to mitigate some of these threats, and really leaning on societal change to find cleaner solutions and cleaner energy sources to support that. And I think that's kind of where Ben's image of advocacy on that continuum from your home, your clinic to the community and legislators really comes into play to work laterally along that.
Thank you for that, Dr. Shah. Okay, I'm just reminding you, please fill out the post-session survey. The link is now in the chat, and it will give you the opportunity, and it will also help us to improve our game. And within that link, you would also find the box where you can tick if you need CME certificates. Okay, so the time has been up. We have had so much fun, learned so much from each other. And of course, we are now going to go out there to do action and actually to engage our patients and to become change leaders. So I would like to thank our presenters, Ben, Dr. Shah, Dr. Barros for being with us. But most importantly, also, I want to thank you participants for coming here today from all over the world, from all the continents. You have really made our day, because without you, we will be talking to the wind, and we really appreciate you. So, and also I want to thank our people who partner with us to make this come alive right now it's every month. And that is, Haley is not here with us today, but we have Daniele. I don't know if she's going to show her face. Cecilia Sorensen from the Global Consortium. I don't know if they're still here. I would like them to just give a wave. And our CEO, yes, Daniele, thank you, give them a wave. And then our CEO, Dr. Hospitalis, I don't know if he's here, Chris Ura from the University of the West Indies. Hi, there is Dr. H. I don't know if Chris Ura is here from UWI, but you know, this is the team. We are the team that put this show on the road every month. And several times a year, we put the show on the road. So I would like to thank you. And I would just like to share the final slide to tell you what is coming up. So next month, please join us again on November the 13th, where we will be talking about climate communications with the media channels. Okay, so this is all for today. We thank you for being here, and hopefully we're going to see you next month. Bye.
Bye, everyone. Thank you so much.
Bye.